Two of my kids, and Marta and my husband and I, had gone to Iowa City to watch my son golf, and we got back after a great weekend, about 45 miles from Kalamazoo, and Marta said, "Oh, I've got the worst headache I've ever felt." Oh, it was the worst headache of my life. I had never experienced any pain like that before, and one that started at my neck and traveled the way it did to the front of my head. So we keep going, and she assures me she's fine. "No, I'm fine." I said, "Well, I think we should drive right to the hospital. I'm thinking stroke." But I didn't say that to her. And she said, "No, I need to see my kids," because her kids hadn't come with us. "I just want to see my kids first." I went right in and Googled stroke, and sudden and severe headache was one of the symptoms that came up, and that's exactly how I would describe it. I went up and got some things out of my suitcase, and when I bent over to do that, then it started all over again, and much more severely, to where I really almost passed out in my bedroom. And she was sitting in a chair talking, and then right in mid-sentence, her head went down and her whole body just went down. And then she got all panicked because her lower half of her body, she couldn't feel it. And she kept saying, "I can't feel my legs, I can't feel my legs." The ambulance came quite quickly, and I had a seizure there in the kitchen after they got there, so I don't remember the ambulance ride or any of that, but I do remember waking up and having Dr. Fabi be at my side at Bronson, and that was a comforting feeling to know that he was there, because I know of Dr. Fabi and his family.
I just kind of calmed her down and reassured her that we had the situation at hand, and we were going to look at it and decide what to do.
So he had called me early in the morning and said that we had a subdural, which is the vast majority of the time almost always a open surgical case, like Dr. Fabi does. So at first I was a little bit confused. It was the middle of the night. I'm like, maybe he's a little tired because he doesn't call me for these. But he's like, "No, it has the story of a brain aneurysm."
It just all fit, kind of textbook sort of stuff. Although where the blood was, it was a little unusual. But again, just the concern was that she had some structural lesion and that I would need an angiogram or something more definitive to find out where the source of the bleed was.
So Dr. Fabi was absolutely correct. It was a brain aneurysm with subdural hematomas, which makes this case incredibly rare. But he basically called me because whenever any ruptured aneurysm comes in, we discuss it together and decide, like he had talked about, which approach is better, the open surgical or the minimally invasive approach.
It's very important for us to have a teamwork in pretty much everything we do. It's great. We just have a collegial sort of environment. I can go to my partners and say, "Listen, I'm not sure about this. Could you take a look?" Or we can go to Dr. Miller and say, "Listen, there's something I need you to take a peek at." And again, put our heads together to make sure the decisions are appropriately made.
Dr. Miller came in the next morning, and he stood at the end of her bed and said, "You've won the lottery of aneurysms. You have an aneurysm, and 5% of people survive what you have been through, and the vast majority of those people are impaired in some way. They're paralyzed or they're cognitively impaired. Now this is what we need to do. I need to go up through your thigh, and I'm going to coil this aneurysm. It's kind of like packing a room with furniture. We're going to pack that aneurysm up so that it won't bleed anymore, and so that it will be benign in there in your brain and not cause you any more trouble." My sister Laura said, "Okay, Marta, this is what we're going to do, right? We're going to go forward with this." And I said, "Yes, we are. I'm going to go to surgery." So the doctor left her bedside, and he was back 10 minutes later, and 5 minutes after that, we were rolling down the hall, and he was taking care of business. So it happened that fast. It was just unbelievable.
So then what I was able to do is manipulate what's called a micro catheter, which is about a little bit bigger than a piece of spaghetti. And over little micro wires, put that through the carotid artery up into the brain and get inside the lumen of the aneurysm, and then basically fill it with these little soft microcoils.
Every member of the team came in, and you could tell that they worked together and communicated well together. A lot of different people checking on her each day, checking her mobility, checking her cognitive function, checking the medications, and they all just worked so well together, and all were ready to answer any questions and take as much time with us as we needed.
I was a patient in the hospital once when I was young. I got in a really bad car accident. I was in a coma for a short period of time. And when I got out of that, my family looked worse than I did. And no one told them anything. They didn't know if I was going to live or not. And my family's in medicine. My father's a physician, my mom's a nurse. And one of the things when I became a doctor, I swore that I would spend as much time as necessary to talk to the families to make them feel as comfortable as possible. And that's the very human side of medicine that I'll always enjoy.
I didn't know about the technology and all of the things, the amazing things that they can do, and I'm just grateful that I had choices and that I had, if I needed Dr. Fabi for his expertise, or I needed Dr. Miller for his, that we're really lucky here to have choices.
You know, I think comprehensive care, as far as cerebrovascular work or operating on the arteries of the brain and spine, being able to offer the patients, all aspects of care, is something that's very unique to this program. We've become basically a tertiary center where patients, drive from a long distance or shipped in from a long distance to come for this expertise in multiple fields. And it's not just the physicians, the nurses, the nurse practitioners, the physician's assistants, to the supporting staff here are excellent, and that they make it possible for us to do all this.
I'm just glad I got home and made it to Bronson, because I wouldn't be here today without that team of doctors. So I'm very fortunate, and I'm very grateful to Dr. Miller and Dr. Fabi and their team, because I wouldn't be here today without them. They saved my life.